Hello everyone. Today we are going to learn the Adventitious breath sound, and my name is Gao Yuan. And for the Adventitious breath sound, so for the Auscultation, you need to pay attention to the Adventitious sounds. So the Adventitious sound include the crackles and the wheeze. So the Adventitious sound include crackles, wheeze, and also the other part will include pleural friction rubs, stridors. So the crackles is like a moisture in the airways. You usually hear it in the inspirations, and the wheeze we can hear mostly in the expiration. Sometimes in the inspiration part we can hear. It's because of the narrowing of the airways. And the pleural friction rubs is inflamed partial, parietal or visceral pleural, cause there is inflammation. When you breathe, they have a rub. And the stridor is the partial of the obstruction of the large airways. So crackles, the first part we learn crackles. What is crackles? Crackles are loud, popping, or snapping sound that are almost explosive in nature and most prominent upon inspirations. Like if you breathe in the air, they have a popping or snapping sounds. So it is non-musical or discontinuous, often interrupted by normal breathing or even other abnormal breath sound. So the crackles usually indicate a collapse of the distal airway, which rapidly open when air enters the respiratory tract upon inspiration, thereby causing a crackling noise. So another cause for crackles is when air enters the lung and the bubbles in secretion. Either fluid in the lung or mucus. It has more of the bubbling sound in these cases. So the classification of crackles in the clinic, you hear some patients, you have different crackles. So we have coarse crackles, medium crackles, and fine crackles. The coarse crackles is usually they have a secretion and inflammation in the large airway. It usually hear the beginning of the inspiration, and the medium crackles is usually heard in the medium airway when the medium airway have inflammations, have mucus, and you hear in the median of the inspiration. And fine crackles are usually heard at the end of the inspiration and the small bronchioles. So the first one, coarse crackles. The normally reasons for coarse crackle like bronchiectasis. So the bronchiectasis may be the large airway or the bronchers, and when the patient have lung edema or pulmonary TB, tuberculosis, of lung abscesses or cavitations. So you hear the crackles is at the beginning of the inspiration, but in expiration you cannot hear the crackles. For the medium crackles, usually the reason is bronchitis, like COPD patient. If you have a bronchopneumonia patient in the clinic, you have the crackles. If you hear the patient have crackles, you need to pay attention. Maybe do some like CT scan and some blood routine and CRP. And for the fine crackles, usually they have bronchiolitis or bronchopneumonia or pulmonary congestion or pulmonary infections. So it usually at the end of the inspiratory crackles is like a fine crackles. And also the micro crackles because of pulmonary interstitial fibrosis. But this like an air go to the bubble and open the small airway. It can hear from the most of the inspiration, the Velcro crackles. So for the fourth one is crepitus. Because of inflammation of bronchial or alveoli or pulmonary congestion, usually caused by early phases of pneumonia or alveoli. It's like you have your hair to squeeze in your hand. You hear this sound, is crepitus. So we have like crackles, but we can have the local lesions of some places. We can have the crackles in the lung bases, or we can have rills over the whole lungs. They have different reasons, different disease can cause this. So we can do this as a differential diagnosis. So if patient have localized lesion of the some places, like if patient have pneumonia, usually they have like a certain like left lung, right lung, or the upper lobe, or the whole lobe. So usually the reason is localized lesion in pneumonia, or pulmonary TB, or bronchiectasis. So if you hear rills over two lung bases pulmonary congestion, it usually indicates the patient have heart failure or bronchopneumonia. So like if patient have heart failures, they maybe have edema of the both legs, they have short of breath, they have rills over both the lung bases. It's called lung bases pulmonary congestion. It sometimes indicates heart failure. You need CT scan, you need to do the heart ultrasound, you need to do the BNP and to find if it's a pneumonia or if it's a heart failure, what is called breath distress. And also they have rills over the whole lung field like acute lung edema or severe bronchopneumonias. It usually indicate a severe disease. And also the next part is wheezes or rhonchi. It's because of stricture or partial obstruction of trachea, bronchial, air turbulent. So the dry rills or rhonchi, they have different classification. For the first one, we have the sibilant rhonchi or snores rhonchis. And second, we can classify it for diffuse bronchi or localized rhonchi. So the sibilant wheezes is like short like g. So the sound smaller bronchis or bronchial, it's high pitches. So the snorers wheezes like moaning or snore is usually indicate there's something wrong in the trachea or major bronchs in low pitches. So we see the snores wheeze here, and sibilant wheezes is small airway, snores large airway, and also the prorab, we hear both inspiration and expirations. And rhonchi can heard on both sides of the lungs, like bronchial asthma, chronic bronchitis, or cardiogenic asthma. So for the localized rhonchi, like bronchial membranous TB and tumor, if they have tumor in one side, you have localized rhonchis. But when you hear rhonchi on both sides of lungs, you need to pay attention of asthma or chronic bronchitis. This one you need to do the CT scan or you do lung functions to diagnose the disease. So this is all the part of the Adventitious breath sound. Thank you very much.